So you just had your baby, your body is bleeding, you're trying to figure out this breastfeeding thing. You're running on maybe 2 hours of broken sleep if you're lucky. And also, you're learning your baby's cries, figuring out feeding schedules, holding back tears because your emotions are really on a literal roller coaster right now. And on top of all of that, anxiety starts to creep in. Is the baby getting enough to eat? Am I doing these things right? Why can't I stop crying? Is a train going to plow through my house? And for some moms, this is what we call baby blues. For others, it might be postpartum anxiety. And for some, it's full blown postpartum depression. And I know this because I've been there. I'm a new mom. I've done this kind of twice in a row now because I have a 3-year-old and a 1-year-old. And when you're in the middle of all this chaos of figuring out, like, what am I supposed to be doing? I'm taking care of this new human now. That overwhelm is really hard to sift through and determine the difference between what's normal and what needs to be addressed. And so I really think it's important in this video that it's not just for the moms. I want to make that clear. This is one of those that is for really anybody that is around a new mom. So if you are a partner, a friend, any part of that mom's village or support system, I want you to be listening to. If you are new, my name is Wallace-Gay. I'm a clinical pharmacist in primary care, and I'm also the community's pharmacist. Here on this channel, I break down medications in plain language so that you can really be more confident in how you take your medications and why you're taking medications, and hopefully help you to be more in control of your health. So if that's something that you feel like you need or a friend or a family member needs, hit that subscribe button so that you don't miss any of the videos, any of the lessons that I will provide on this channel. So the first thing that I think is important to talk about, and I'm going to go to my notes so that I make sure that I stay on target, and I'm very passionate about this, so I don't want to get too far off of the things that I want to talk about today. So the first thing I want to talk about is why postpartum appointments matter. So, lots of people are having babies every day, and the statistic says that 1 in 8 moms in the US will experience postpartum depression. But unfortunately, many people skip that postpartum appointment because they feel fine, or they think they feel fine, or because they are too busy running around doing the things that the baby needs, like last minute things that you may not have thought of. Now you got to go do a Target run. The baby also needs appointments as well. So you have to go to like the 3-day appointment and the 1-week appointment and all these things. And so you end up skipping your own postpartum appointment. And during these appointments, of course, they're going to check if you've had a C-section, your stitches, make sure there's no infection, bleeding is appropriate or starting to go away. They're going to check your blood pressure, all that good stuff. But they're also going to check on your mental health. And they usually do this by just asking a series of questions. And those questions may seem simple if you're not really affected by anything. But if you are, you might be like me and start crying while you're answering the questions, thinking about why was I crying in the situation that the question is asking me. And so they really want to try to catch baby blues and differentiate it from postpartum depression, which is usually something that would be picked up if it's been more than about 2 weeks and you're still feeling in that sunken place or that overwhelm. And so they really want to catch that early before it spirals. So those appointments are really important, and it's important that you go in and that you're really transparent. So, of course, I'm a pharmacist, so I want to focus on the treatments and talk about those things. And the first thing that I listed here was therapy and counseling. So let me be clear, like, treatments are not going to be a one-size-fits-all scenario, just like most other things in life. But I do think that there is some power in just talking to someone about it, someone who is a licensed professional. Like, you may have other people in your life that can be helpful that you can talk to, but it may get to a point where really talking to someone who is trained in this can be a big deal. It can be life-changing for you. So although that is not a medication-related thing, I'm always focused on like the non-medication-related things first. And so one thing that I think would be helpful is therapy or counseling. I'm sure that there are definitely some virtual options for that as well if getting out the house for yet another thing seems overwhelming, but definitely consider that. And I'll pause here to say before I go into the drugs that if you are pregnant and watching this, or know someone who's pregnant and you can send this to them, I think it's important to think about these things before you're in the midst of the overwhelm because, as I mentioned, so many things are going to be kind of hitting you all at once. And your emotions and hormones are going to be in the middle of that. And is as well put together as many of us like to think that we are. When we are in the middle of postpartum, I mean, there are times when I'm like, I look back and I'm like, oh my God, I was so in the midst of it and I couldn't even recognize it. And people may be thinking like, oh, you're overreacting or why are you doing this or why are you acting that way? And it's like, I don't know either. Like I'm in the middle of it. And so I think it's just important to think about these things before you go into it. Definitely after having my second kid, I felt a lot more in control of my postpartum situation because I knew what to expect. And before my first kid, it's like I kind of knew from a clinical perspective, from an outsider perspective, but then having never experienced it, it wasn't something that I knew firsthand. And so I felt a lot more overwhelmed after the first kid. But anyway, so I think just thinking about these things before you get in the midst of it and having these conversations with your provider and your partner and your village is going to be helpful. Okay, so let's get into the drugs. So the first class of medications that we can use are called SSRIs, selective serotonin reuptake inhibitors. And so these are medications like Zoloft and Prozac. The generic names for those are sertraline and fluoxetine. And there are others. There are 8 or 9 SSRIs. So there are several others out there. But essentially how these medications work is that think about your brain as having like little messengers. One of those messenger chemicals is called serotonin. And serotonin carries around these feel good signals. They make us feel really good. And so these signals are carried around throughout the brain cells. And so in someone who is experiencing depression, those messengers don't really hang around long enough. They don't hang around in the brain long enough. So it's kind of like a text message that disappears before anybody gets a chance to read it. Like, it was there because you sent it, but it disappeared. It has that signal that disappears. And so serotonin may be disappearing or not sticking around long enough in someone who has depression. So these medications, SSRIs, are the thing that stops these texts from being deleted. It's the thing that allows serotonin to stick around longer. So it allows serotonin to stay around in the brain so that we can actually utilize it to help us feel better instead of it going away so quickly. So these medications usually take a few weeks to start working, which is the hard thing about it. And when I say a few weeks, like we typically counsel people, you might start to feel a little bit different, especially if there's some anxiety in there too, within about a week or so. But like to really get the full benefits of these medications, it takes about 4 to 6 weeks. So they're good drugs. They're safe. They're safe to take in breastfeeding. So that's not something to be concerned about. But it may take a little time before you really start to feel the full benefits of these medications. The other class of medication that I want to talk about are called the SNRIs. And so these are selective norepinephrine reuptake inhibitors or serotonin norepinephrine reuptake inhibitors because they work on both serotonin and norepinephrine. Serotonin we talked about being the feel-good messenger, and then norepinephrine is our kind of get up and go messenger. It's the thing that gets us going. And so one of the medications, or there's really just 2 main ones in this class that we talk about. One is called Effexor, and its generic name is venlafaxine. And the other one is called Cymbalta, and its generic name is duloxetine. So these medications, they, of course, help with the sadness because they allow that feel-good messenger, that feel-good chemical, which is serotonin, to stick around longer, just like the SSRIs do. But these also help with if you're having issues with focus and low energy and things like that, because they allow norepinephrine to hang around longer as well. And norepinephrine is that get up and go chemical. So these are gonna not only make you feel good, but also give you a little more energy. That could also mean that your blood pressure is gonna go up a little bit, things like that. that's a conversation for another day. But in terms of treating your mood, it helps with your energy and also helps you feel, happier because it helps with both of those messengers or both of those chemicals. So those are the two main classes of medications that we might see for postpartum depression: SSRIs, struggling with that one today, and SNRIs. So those are the main two. Now, I do want to take a moment just to talk about some of the supplements that can be used. So one of which is omega-3s. You can also do vitamin D and iron. And there's some data out there that supports that these just help with hormonal balance after pregnancy. And so this is a good place to insert. And this is just kind of off the cuff, but uh, taking a postnatal vitamin is going to be really important. We always talk about prenatal vitamins, prenatals, which are super important. So this is, you should be taking your prenatal from the time that you decide you want to do the things that could make you pregnant until all the way through your pregnancy. But afterwards, taking a postnatal, which could have some very specific supplements in it that can be beneficial, would be really, really, really important. And so if you want to take a postnatal supplement and you're not sure which one to take, I took Ritual for pre and postnatal, and I do have a link for that I'll put in the description box. But if you don't want to order Ritual and do it through that way, you can just get a multivitamin over the counter. That will work as well. That will at least have your vitamin D and probably your iron in it, but you may need to get something else for your omega-3. So these things aren't necessarily replacements for treating, your mood, your depression when it's at a point where it's really overwhelming. But these are things that could help get that balance where it needs to be. So make sure that you're giving your body those nutrients that it needs, during that postpartum phase as well. Okay. The last medication I want to talk about is fairly new. I think it came out in 2023, but we don't talk a lot about it. Like, I haven't personally talked a lot about it to anybody or recommended it to any of the physicians that I work with in clinic. I never heard my OB talk about it. And I just haven't heard a ton about it, but I want to talk about it here so that you can bring it up with your provider and at least talk about whether or not this would be an option for you, if it's going to be covered in your insurance, all of that. And so the name of this medication is zuranolone, and its brand name is Zurzuvae. It's kind of a tongue twister as well, and kind of spicy. So Zurzuvae, or zuranolone, as the generic name. And so this medication is really interesting to me because it's a pill, so it's taken like the other ones. All the other ones I talked about are pills as well. But it's the only thing that is specifically approved for postpartum depression. And what makes this one really different is I mentioned with the SSRIs and the SNRIs that those take maybe 4 to 6 weeks before you start to see the full benefit. Well, with this medication, zuranolone, it only takes about 3 days before you start to really feel the benefits of the medication. And to me, that's groundbreaking. That's game changer, because if you're in the midst of overwhelm, like, you don't really want to have to wait 4 weeks to feel fully well again. It starts to do its thing before then you start to incrementally feel a little bit better with those other medications. But this one has the claim to fame that in as little as 3 days, for some people, they start to feel like fully, well. And so I think that that's really, really interesting and really important. Also, in the other medications, you're usually going to take those for at least a few months. It's going to take at least a month before you start to see full effects. But most people are going to be on them for 2 or 3 months, and then reevaluate and try to come off of them once you hopefully have some more stability in hormones and your mood and chemicals and all of that. Well, this medication is just for 14 days. So it's a 2-week regimen, reassess after that, see how you're doing. But within that 2 weeks, you should be feeling a lot better and not have to take it anymore. So I think that that's really nice too, so that you don't have to worry about adding on yet another thing for a long period of time that you have to continue to take every day. So the way that this medication works is, well, let me back up. So if you think of your brain as like, I don't know, a busy city, the hustle and bustle of a city. At night in the city, the streetlights come on and they help to keep things calm and hopefully safe. In postpartum depression, the brain feels really dark. A lot of the lights have gone off. There's a little bit of chaos there. And what this medication does, zuranolone, is it comes in and it kind of turns some of those street lights back on again. It helps restore safety and calm the chaos. And so specifically, there is a chemical in our brain called GABA. So I already talked about serotonin. That's makes us feel good. I talked about norepinephrine. That's get up and go. And then we've got GABA. And GABA is like our calming chemical in the brain. It helps calm everything down. And we need all of those things, but there needs to be a nice balance between those. So in postpartum depression, there's usually not enough balance. There's an imbalance there. So this medication comes in and essentially helps to slow down the racing thoughts of anxiety, ease that, and stabilize the mood. So it just replenishes some of that calming chemical, which is called GABA, that might be off balance or that might be missing if you are struggling with postpartum depression. So that's how this medication works. One thing or one caveat about taking this medication is that it does have to be taken with what I would call a moderate to high fat meal. So it specifically says that the meal has to have 25 to 50% of it coming from fat. Um, and that is with a 400 to 1,000 calorie meal. Now, if you have ever, or if you're about to go into breastfeeding, listen, girl, ravenous. Like I could not stop eating when I was breastfeeding. I mean, I had to pump the brakes on myself and just like make sure that I was at least eating healthful things because your girl was hungry all the time. So I don't think eating is going to be the issue, but making sure that you are consuming the right amount of fat within that meal. So that could be through avocados, nuts, oils, lots of different ways to get that fat in. And then it's supposed to be taken in the evening with dinner. And part of that is because it makes you really drowsy. And so a couple of things to keep in mind here. Take it at dinner time with a high fat meal, moderate to high fat meal. Make sure that you are not doing anything extra. And make sure that there's somebody around because you are still caring for your baby. So if you're going to feel drowsy and all of that, you want to make sure that you can still safely care for your kid, of course. So I know that you guys know that, but just to kind of put that at the top of your mind if this is something that you start. And then also you don't want to really eat a super heavy meal right before bed. So try to have your dinner and then maybe not have much to do right before you go to bed, other than just kind of sit and chill. With this medication, because it causes a lot of drowsiness and you just kind of feel kind of loopy for a little bit afterwards, you're not allowed to drive for 12 hours after the dose. So that shouldn't be an issue. Again, if you're home, you're having dinner, chilling out for a minute and then going to bed. And I put that in quotes because like you have a newborn. Are you really going to bed? I don't know. Especially if you are having to get up and you're nursing straight from the bosom. But you shouldn't drive within 12 hours after taking the medication. So just keep that in mind. Something else. Oh, I wanted to mention with this one, so I have my notes, is that access. So insurance coverage for this is kind of spotty just because it's still fairly new in the world of drugs, although it's about 2 years old. That's still considered kind of new when it comes to drugs. So not every insurance is covering it to the same extent. And I don't think a lot of the providers are really aware of it. So if you walk into your appointment and you're like, I don't want the SSRI, I want to try this other medication. Let's just see if it works. Because if I can try something that will help me feel better after 3 to 5 days, I can only take it for 2 weeks and be good. I'd rather do that than something that takes months to work. That's fine too. You could also walk in and say, I don't want the newer drug. I want the SSRI. It's tried and true. We've been using it for years and you want to go that route. But at least you're informed and you can make that decision with the best information that you can have at that point. So just know that there are things that you can ask for. And if you do decide to go with the newer agent, you might have to look and see if your insurance will cover it, or maybe your provider can write like a message that overrides and asks the insurance to cover it for you. So, the last thing I want to get into is just one final pause. And, if you're watching this and you're the one going through it, I really do know how heavy it can feel. And you're thinking, I'm supposed to be happy. I've got my baby. Why do I feel so empty or tired or exhausted? I don't really want to be dealing with a whole bunch of extra other things. I promise you, like, taking something will be okay. Like, try the Zoloft, try the Zurzuvae, or try something else. Try to talk to somebody, but don't just let it fester. Don't let it linger. And again, I think if you're going into this and you have not yet delivered your baby, it's a really good time to be thinking about it as well. Or you might be watching this or listening to this at 2 a.m. as you are currently nursing your baby and feeling all the overwhelm. Either way, I think that, just finding out what's going to be the best fit for you. And you really only know that if you know what the options are and also have that conversation with your provider at your next visit or in between your visits. Um, all right, so here's what I want you to do. If you're a new mom, don't skip your postpartum checkup. That was number one. Write down everything you're feeling. I had a little book that allowed me to track everything that I was feeding the baby, diaper changes, all of that. I'm kind of type A, so if that's not you, that's okay. But there was also a little place for notes where I could write little things down because when you go to the kids' appointment, they're going to want to know how many diapers did they wet or poop. And I'm like, I don't know. Let me look in the book. And same thing when you go to your own appointments, they're going to ask you these questions. And sometimes in the moment, it's hard to remember. So if you just write it down, that will help. And you can take that with you to your appointment. For your partners and your loved ones, send them this video and say, hey, like we in this together. If I start to act a little different or seem a little odd, just support me in that. And maybe I need some extra help. And that way they can help identify those things in you as well. And then ask about all your options from our tried and true SSRIs, said it right, to our new breakthroughs like zuranolone, Zurzuvae. Those are medications that are there to help you rebalance those chemicals, the feel good chemical, your calm down chemical, your get up and go chemical. All of those things need to be in proper alignment. I want you to feel seen. I want you to feel supported. But most of all, I want you to feel like you know what your options are if you come to a point where you feel overwhelmed and know that medications can be a temporary approach to helping to solve that. So if you found this video helpful, I hope that you did. Please hit that subscribe button, have a conversation with your loved ones about medications, and hopefully this made some of these medications make sense for you. And until the next time, cheers to better health, better meds, and a better you. And I'll see you in the next one.